My name is Claire. My background is I'm a registered nutritionist, which means that I have done a degree in nutrition, and then being registered, we have to apply to like a board certification to become and stay registered, and we have to do our CPD hours and everything like that. And also, I'm an exercise physiologist as well, so that was my other degree at university. So that's what I studied, but I now specialize in polycystic ovarian syndrome because that's what I struggled with personally. And when I was going through this in my mid-20s, I found that there was very, very little help for me. I was trying to go and see specific women's health doctors and reading different books, but no one could really give me any concrete answers as to why I was struggling with these symptoms. So my symptoms specifically were weight gain that really didn't match my lifestyle. So I was an elite athlete at the time, so I was competing internationally in athletics and then triathlon latterly. And so I was training about 21 hours a week. I was also studying, in this space and then graduated and still couldn't work out why I was gaining weight, even though I'd apparently spent 5 years learning this. I also didn't have a period for about 3 years, and I was also getting acne well into my 20s when it was, what I knew was not the norm. So those were the symptoms that I kept going and seeing doctors about, and it wasn't until I just happened to get a really good doctor where I moved cities and just happened to find a doctor. I wasn't even really looking because I hadn't been diagnosed at this stage, and I just said, look, these are the symptoms I'm struggling with. And she was like, I think I might know what's going on here. Did the testing, and sure enough, she diagnosed me with polycystic ovarian syndrome. The problem was, though, that she didn't really understand enough to tell me too much about that. The only really she could tell me was that this was likely while I was struggling with the symptoms of cycles and weight gain and acne. And the only thing she really knew to tell me was that also as she said, I will struggle to conceive later if that's what I choose to do. But no real guidance from there apart from and her treatment options were quite limited based on her background as well. So she said, look, the only things I can really offer to you is to go back on the pill. I think I was already still on the pill at that stage. And also metformin, because she also diagnosed me with insulin resistance at that time too, which was a massive shock for me. I mean, I was an international athlete. I'd also spent 5 years learning about insulin resistance and why people develop insulin resistance. And really at that time, and still what's being taught today, is that insulin resistance is a lifestyle disease. And basically what we learned, the summary was, if you've developed insulin resistance and diabetes, you have mismanaged your lifestyle, right? It's your own fault. And that's what I thought when I got diagnosed with this. I thought, gosh, I've been the one that's mismanaged this, but I don't know how. I don't know how I could exercise more. I don't know how I could eat better. And so it left me feeling really, really despondent, to the point that I didn't even work in nutrition or exercise science for the next 5 or 6 years. I went and worked in technology because I was so mortified that I had these conditions and that I had developed this, and how could I possibly help someone else when I couldn't even help myself? So it was through that time, my own gradual learning, that I then studied further in functional medicine, and that's when I sort of understood a bit more about how these two things were connected, how insulin resistance and PCOS were connected. But not only that, how stress hormones and thyroid hormones and everything else in our body is connected to our PCOS, and how when we fix those underlying drivers, the PCOS symptoms can miraculously resolve by actually treating that underlying stuff. So that's then why I started specializing in this, because I knew the struggle that I have found in getting the treatment that I needed. And I knew that there were thousands, if not millions, of women out there looking for the same thing as what I was. So my journey has really taken me from, really understanding that and taking a truly holistic view that medications are fantastic. Holistic and underlying health treatment is fantastic. And for many people, it's the combination of the two that leads them to the best results. The one thing that I do find really prevalent, though, in women's health in general is a real lack of informed consent around a lot of medications and really understanding how they're working in your body. And I think this is a factor of our doctors having so little time with us to be able to actually tell us what something's doing and how it's working in our body. But also too, I think there's a real sort of assumption in health that we are not interested or not smart enough to really understand how something's working. And so therefore it is dumbed down to a really low level. And I think this is a massive injustice to all of us, and especially females, because we tend to take a lot of these medications like hormonal contraceptive throughout our life, whereas a lot of males aren't on any medication at all during their 20s and 30s and even teenage years. And so this is what we want to change, is true informed consent. And by true informed consent, I mean you understand exactly how that's working in your body. And a big example of this in PCOS is hormonal contraceptive, and the typical way that is described to a female or person with PCOS is that what the pill is going to do is it's going to quote unquote regulate your cycle. Now that is absolutely not true. The pill will give you a bleed, but it is not fixing the problem of PCOS, which is that your body is not ovulating or not ovulating regularly, right? The pill, by definition, stops ovulation. So it is never going to be able to regulate ovulation, which is the whole problem why you might not be getting a bleed. So that's the kind of information that we want to put into the hands of the woman, because I've seen so many examples of my patients who have been on the pill, getting a regular bleed, and thinking that when they come off the pill, that now they have this regular cycle, that everything's going to be perfect for them to conceive, only to find out that they were never ovulating. They haven't probably ever ovulated because they got put on this as they were a teenager. And now their body has to learn how to do that. And it might take a couple of years to do that. And they feel really misled. And so that's the part that we want to make sure that we can fix. And we have the time. We have the time with our patients through our digital technology and with longer consultations that we can actually do that, where we can sit down and say, these are some options for you. This is exactly how they work. And these are all the benefits and all the negatives. And now it's for you to decide what works for you. PCOS is essentially when the female body produces more androgen hormones than what's really optimal. So androgen hormones, the most common we know that you will probably know of is testosterone. But actually there is a group of androgens hormones, so it's not just testosterone. But what this means is that when we have higher testosterone, that does things like gets into our skin, our hair follicles in our skin, and causes them to turn from the peach fuzz into dark, what's called terminal hairs, long dark hairs that you would think of in terms of like growing facial or body hair. It also gets into our oil glands in our skin, causing them to overproduce oil, which then leads to acne, especially in this kind of chin and jawline area. It also messes with our sex hormones. And that means that we don't ovulate very regularly. So normally people will ovulate around about every 12 to 16, 18 days. And then they'll get a period, so a full cycle from day one of your bleed to day one of your next bleed. What is a normal cycle is between 25 and 35 days. Doesn't matter if it varies a little bit, that's still what's classified as a normal cycle. What happens in PCOS is that testosterone and those hormones get a bit disrupted. The analogy we use is that they've got a bit drunk. Testosterone's made them a little bit drunk, so they're just kind of like not firing at the right time. And so what happens there is that you will likely get longer cycles, so more than 35 days. And what that means is that your body is trying to ovulate and it's just not quite able to get there. And so it will then try and ovulate again, and then until it's able to actually successfully ovulate, which then leads to a period if you're not pregnant. So a long cycle is one of the features of PCOS. The other symptoms can be weight gain. Again, this higher testosterone means that we are more likely to store fat, to store energy as fat. and also that we're more likely for our insulin hormone, which manages our blood sugar, for our body to become a bit desensitized to that, which means that we develop some insulin resistance, which further makes our body store more fat, which then causes further testosterone production, which causes further weight gain. So it's a really vicious cycle. So we like to call weight gain as a symptom of PCOS, whereas a lot of people are led to believe that they have developed PCOS because they're at a higher body weight, which is, we believe, totally untrue. Other symptoms, so irregular cycles, which can then lead to fertility challenges. So for many people with PCOS, those irregular cycles mean it really hard to time intercourse in order to conceive, and also means that our body's production of the hormone progesterone might be a little bit lower, which then also makes it really hard for our body to actually hold on to that pregnancy as well, if we do manage to conceive. But these things are all totally reversible. So that's the great thing about PCOS, especially when it comes to fertility, is that we're not missing any sexual organs. Everything is there. We've just got to help our hormones work better together, stop testosterone from causing them to get drunk, and actually get them to work properly together so we can ovulate more regularly on around that day sort of 12 to 16 ideally, just so that you get more attempts through an entire year of actually conceiving. Because you imagine if you're only ovulating once every 50 days, you've then only got about 7 chances in the year to conceive when your body is actually ovulating. So that's the goal. But the brilliant thing is, you're not infertile, you're not missing any sexual organs. We can absolutely achieve fertility. We've just got to help those hormones work together. And that can be through either lifestyle stuff or with medications as well. The prevalence of PCOS is now estimated to be 1 in 8 women. A couple of years ago, they were calling that 10%, but it is increasing. And this is because of those lifestyle factors. So PCOS really is it's like our genetics predispose us to developing it, but our environment or how we live, so what we eat, how we move, how much sleep we get, our stress levels, our vitamin and nutrient levels, all then predispose us to developing that. So just because you might have the genetic predisposition doesn't necessarily mean that you'll develop it. Similar to like breast cancer, you might have the BRCA1 gene, but that doesn't necessarily mean you're going to develop breast cancer. But it just means that we are more predisposed to it. And so that's why we're seeing, an increasing incidence in PCOS over the last 50 years.